kind of leads into our next topic, which is painful periods. You know,
Right.
one of the biggest treatments for painful periods is birth control. I have a few ladies that work with me, and they were telling me when they were younger, they had really bad cramps. They'd be sprawled on the floor, not able to go to school, and their parents would still not let them get on birth control because they were afraid that it would affect their future fertility. And so I think it's so important that parents become comfortable with the idea of birth control and know that there are different options, and you know, the right option for that condition that their daughter is going through will help her live better now and still protect her future fertility.
Right.
Yeah.
Exactly.
Yeah. And so I know that they probably come to you first when their periods are painful.
Yes.
What have you found to be, how does that play out in your clinic when they come?
So one is, oftentimes, as you know, when you first have a period, you're not ovulating. So a lot of times the girl is like, hallelujah, I have a period and I don't get cramps. I don't know what this cramp thing is about that people talk about. And then those 3 years happen, and now they're ovulating every month and they're regular every month. And now they're getting cramps, right? They're getting bloating, they're maybe getting like constipation or diarrhea, they're getting more symptoms, right? The signs of the prostaglandins and things like that.
Yeah,
So
the
now they're
progesterone.
coming in and the mom is like, well, she didn't get cramps before and now she's getting cramps. Like, what's going on? Well, I tell them that now she's actually producing an egg. And, this is actually, again, a normal, good sign of a
Vital
healthy body.
sign.
So
Yeah.
it's a good sign of a healthy body, although no one wants this, right? Like, I wish I wasn't healthy. Um, um, so, so really, like you said, though, scrawled on the floor in pain, that's not
That's
normal.
not normal,
You
right?
know, um, not being able to go to
Go to
school.
school. That's not normal.
Really, that's the key thing is that, one is that sure, some kids will try to get out of school for just getting out of school purposes,
Mhm.
but really, if they tell me that they've missed multiple days of school due to their periods, or that each month they miss 1 or 2 days of school, that really is a big red flag, right? We always talk about red flag, red flag. I
Mhm.
would say that's a good red flag to know, for parents or for anyone, is
Mhm.
that that's a red flag. Like, that's not normal.
Mhm.
Like, normal is I take a hot bath when I have a period and
Mm.
it's painful. I use
Right.
a heating
Heating
pad.
pad.
I take an NSAID,
Right.
ibuprofen, Aleve,
Ibuprofen.
naproxen. I take Tylenol, Midol, whatever is on over the counter.
Mhm.
I take these products, that's normal, and I get relief. I would say that those things, but scrawled on the floor, um, you know, um,
Missing
missing
school.
school, not able to do normal activities, can't get out of bed. Those things are red
Not normal.
flags,
Yeah.
not normal.
Yeah, that's when to worry, right? And take it to the pediatrician or the
Mhm.
gynecologist, you know, depending on the age.
Mhm.
Right. And so what at what level do they get with you before you send them off to someone else for the treatment of that?
Well, first of all, is what I tell them is I ask first about how regular they are.
Mm.
So, are you regular? Are you having regular periods? Also knowing, like, there's also something called Mittelshmerz, which
Right.
which is pain in between your cycle,
Cycle.
due to, the
Ovulation.
follicular and ovulation. So
Mhm.
sometimes there is something else going on. So
Mhm.
knowing when the
The
pain is
pain
happening,
happened. Mhm.
sometimes there can be signs of a cyst, right? And that's
Mhm.
painful. So there's different things going on too. that you have to elicit on history and exam. But, one thing I say is I ask how regular are their periods. I ask what are they like, their flow. I ask about those things to kind of just see, are their periods normal in that context first, right? Which, and then if they're normal, I say that's awesome. That's a good vital sign, right? And then I say, are you using a period tracker? A lot of teens actually are, so it's not like a new thing to them. And I go, great. So what I want you to do is 2 days before your period, start taking a leave, depending on the age, or ibuprofen, which is, Advil, Motrin, these kind of things. Start taking it 2 days before you think you're going to have your period. Or when you have that tummy feeling that you're going to have a period, start taking it then and continue to take it throughout when you usually have these symptoms, and see if there's a difference. So I want you to do that. And if you don't notice any difference, and then I want you to come back. So after 2 periods that you've tried this, you're like, doc, that did nothing for me. Like, I'm still like living the worst life ever. I want you to come back, because I think that could be a sign of endometriosis. I think that could be a sign that something else is going on. Maybe we should do an ultrasound, look for maybe a cyst or something like that, or what have you. So that's when I say that maybe there's something else going on here that is not normal dysmenorrhea or normal painful period.
That's a great point. So like you said, when the 3 years are over, now they're ovulating. Mittelshmerz is where, they're actually releasing an egg from their ovary. And that release is actually a rupture of the cyst that's holding the egg. So when I explain it to my ladies who come in with pelvic pain, I ask them, so when did you feel this pain? They give me a date. When was your period in relation to this pain? Oh, it was 2 weeks after my period. Then I know that they're ovulating at that time. They release the egg, which consists of rupturing the cyst where the egg was in. And that's what causes the pain. And like you said, ibuprofen, rest, the heating pad, it goes away. That's a normal pain that happens every period. Some people feel it more than others. You bring up a great point in that, they track their periods. I do the same thing with my ladies. I tell them, I actually say a week before your period comes. So a week before, you're taking ibuprofen once or twice a day. And sometimes people tell me they're taking like over-the-counter Tylenol, the 375 milligrams. I'm like, that's not going to do anything. You got to take, even the ibuprofen, you got to take like maybe 400 milligrams, once or twice a day. And I tell them it blocks the pain centers so that when the pain is coming, it's not as intense because the pain centers have been blocked by that pain medication. And for most people, the painful periods are resolved by that. I saw a couple teenagers, I haven't seen a ton of teenagers, and I thought they came back to me and that seemed to work for their pain. But like you said, if it's not resolving, if it's persistent pain, it's not related to your periods at all. Then we start looking for a cyst. This pain is always there no matter what I do, with whether my period is coming or my period is not, then something else is going on. With endometriosis, I think there's mixed information out there about endometriosis, but like you said, 2 days before, that's when the pain becomes severe. It worsens throughout the period, but then it ends right as your period ends. That is sort of a sign of endometriosis. And one of the first things we do could also be pain medication. But if that's not working, then we start going into the treatment with birth control. And if that works, then we sort of give them the diagnosis of endometriosis based on that. And so that's why I kind of want to get parents comfortable with the idea of birth control, because sometimes it's how we can fix some of these issues going on with kids, with girls. But like you said, painful periods, heating pad, Tylenol, it goes away. That's a normal vital sign. If you're sprawled on the floor, missing school, can't go to school, that's when to worry. And like we said, it could just be they need an ibuprofen the week before. It could be that they need birth control. We just want to be comfortable with, giving them these treatment options. Anything you want to add to that, Dr. Emma?
I think no, only what I'd like to add is, can you define what endometriosis is for
Mm,
those who may not know?
right. Thank you for that. So think of the uterus like a balloon, and it has a cavity. The inside of the cavity is what fills up with blood when we're having our period, and then we shed that blood as our period. If some of that tissue from the inside of the uterus, the cavity called endometrium, the inside of the cavity is called endometrium. If it gets outside the balloon, outside the uterus, gets on the ovary, gets on the tubes, gets on the in the groin area, the ligaments in the groin area, and implants in those places. So every time you're having a period, you're not just shedding the lining from inside the balloon, you're shedding it from the ovary, you're shedding it from the tube, you're shedding it from the groin area. And so those endometriosis implants in the abnormal areas start reacting to your estrogen going up when you're about to have your period. And so the pain begins because those guys are only supposed to be inside the balloon. They're
Mhm.
on areas that have nerve endings. They're an area that are very sensitive. And those guys start reacting and causing a lot of pain as the body's preparing to have a period and the estrogen level is super high. We still don't know what causes it. There's so many theories about what causes it. They think maybe the blood is flowing back through the fallopian tubes. They think it's carried through the lymphatic system. We haven't settled on a cause. We just know that if you look inside the belly, you can see the endometriosis in places where they're not supposed to be. That's the diagnosis. But we don't like to operate on young people. And so we just kind of treat them. And if the symptoms get better, then they sort of get the diagnosis based on their clinical symptoms. So just to recap, the uterus, think of it as a balloon. The inside is endometrium. That endometrium being anywhere else aside from the uterus is endometriosis. And it reacts to estrogen when you're about to have your period. That's what causes the pain.
So every month, those areas outside your uterus
Uterus.
will also become inflamed,
Yes.
and
And reactive
that's what causes this issue every time.
every time. And
Mhm.
that's why the pain begins even before the flow starts, because those
Oh.
areas are reacting to your estrogen going up and your progesterone going up, which the estrogen and progesterone fluctuations are what causes you to have a period. It's only your uterus that's supposed to respond to that. And so if the part of the uterus tissue is outside, those guys are also reacting to that. And those areas are not used to having such irritation. And so
Oh.
they cause a lot of discomfort, a lot of pain, and a lot of scarring. It can cause scarring because you're shedding from those areas where you're not supposed to shed. That can clump things together in the pelvis and make the uterus, all stuck together, make the organs stuck together. So endometriosis is a really, really difficult disease. And we try to manage the symptoms. And in some people, we have to do surgery, but we avoid surgery in younger people.
Sure,
Yeah.
makes sense.
Does that make sense? Okay, good.
Yeah.